Hello everyone, my name is Leah Thyberg and I'm going to give you an overview of cystic fibrosis today. So what is cystic fibrosis? Cystic fibrosis is a genetic disease that's pretty rare but does occur mostly in the white population, at least in the United States. It occurs in about 1 in every 2,500 to 3,500 white newborns, so about an average of 1 in every 3,000. CF is a little bit less common in other ethnic groups, so mostly prevalent in the white population. So cystic fibrosis was identified and recognized as a disease in 1938. Early in its diagnosing days, the life expectancy was really short. It was only about 6 months. So it was really, really short, and through technology changes and just medical advancements, we'll talk a little bit more about that later, but the life expectancy has been raised greatly. Cystic fibrosis is basically a mutation of the CFTR gene, and it is inherited via the autosomal recessive pattern. And basically what that means is both copies of the CFTR gene have mutations. And for an individual to actually have CF, both of their parents have to at least be carrying the gene. So they don't actually have to be affected with CF, but at least both of them have to at least have one copy of that gene. Some characteristics and symptoms of CF. This disease is characterized by the buildup of a thick and sticky mucus that causes a lot of damage to the body's organs. Most common signs and symptoms include damage to the respiratory system, chronic digestive problems. This is an interesting disease because the severity of the symptoms and just overall features of the disorder vary among individuals. So you might see someone with a lot of respiratory problems in a very severe manner who has CF, and then another patient with CF that has more digestive issues, still respiratory, but maybe not as severe as the first. Another interesting thing about the signs and symptoms of CF, it has to do with some of that mucus that I was talking about. So mucus, while it is a naturally occurring substance in the body, we all produce mucus and it actually helps us in a lot of ways. It can be really dangerous if there's too much of it or it's too thick, like it is in CF. Like I said before, mucus is a healthy part of the human body and really helps to protect the linings of airways, digestive systems, reproductive system, and then some other organs and tissues. But in a CF patient, their mucus is sticky, stick, and it can actually clog that airway. And that's why there's respiratory problems. That's why there's digestive issues. The infection causes chronic coughing, wheezing, some inflammation. And then over time, that mucus buildup and infections can result in even permanent lung damage, scar tissue or fibrosis, and cysts in the lungs as well. As I mentioned before, CF is an autosomal recessive disease in its transmission. And essentially that means that 2 copies of an abnormal gene must be present in order for the disease to develop. So let's say in this picture that the little r represents the mutated gene for CF. In this example, both parents have that gene. Since it's recessive, they do not present with CF, and therefore they are called carriers. When they produce offspring, each of those parents are giving one of those genes to each offspring. So there's a 50-50 chance that each parent is giving the gene of CF, that little r, that mutated gene. CF is only present when both copies of the gene are mutated, like we see in the 4th child here. So in this example, we can see that both parents are carriers and they produce 4 children, one who is unaffected and is not a carrier for CF, 2 that are carriers for CF but are not affected with the disease, and then 1 that is affected with disease. And that's because he or she received both mutated copies of the CFTR gene, 1 from each parent. Another example of this is visible in this pedigree that I created for just to represent the transmission of CF and the mutated CFTR gene. So you'll see that in this example, both of the great-grandparents are carriers because they have one copy of the mutated gene and one copy of the healthy gene. Only one of their children is affected with CF, Regina, on the right-hand side of the screen. Interestingly, with an autosomal recessive gene disease, the disease can actually skip a generation, or we say skip because meaning it's not visible in the generation, but it's still acting in there in a recessive manner. So for example, if you're looking at the pedigree, you can see that Bess, 2 generations from Robert and Sally, is actually affected with CF, where no one in the generation before her, her parents were not affected and neither were her grandparents. So essentially it's skipping a generation, we call it. And that's because it's recessive. So Bess, Alex, and even Angie here kind of narrate and are an example of that quality of the autosomal recessive nature of CF. All right, so diagnosing CF. CF can be diagnosed in a few different ways, and it usually requires a combination of genetic testing and newborn screening and even a chloride sweat test. So early detection is super important when it comes to diagnosing CF. There is research to support the claim that children who receive CF early in life can have better nutrition, better treatment, and that can really just lead to an improved growth in their body, lower number of hospital stays, and even addition to years of their life and healthier lungs. So early detection is super important, and a lot of babies with CF are diagnosed very early, and doctors really advocate for the early detection of this disease. So let's talk about the newborn screening and the sweat test as 2 of the diagnosing agents outside of genetic testing. So the newborn screening is the first thing that we're going to talk about. And what this is it's initially looking for measures of a certain immunoreactive quality in the blood. So infants with this specific immunoreactive quality can actually, it's an indication that they need further testing because they may or may not have CF. So this is kind of the first line of defense. Definitely doctors don't diagnose CF just with an abnormal screening, but it kind of gives them an idea of where they need to look next. And that next bit is the sweat test. So the sweat test is measuring for abnormal amounts of sodium and chloride in the sweat. So people with CF have increased amounts of sodium and chloride in their sweat, and so this sweat test is kind of testing for that. And basically what they do is they're not injecting, they are stimulating the sweat glands via a specific medicine that is placed on a newborn or a baby, and then electric current helps to propagate it across the skin, and then it produces sweat. Super interesting, painless, harmless, doesn't hurt the child at all, but essentially makes the child sweat, and then the practitioner will collect the sweat and then test it for higher amounts of sodium and chloride. And a little side note here, while I was reading, I read that back before all of these fancy tests, CF was called the salty kiss or something like that, back in like a German research paper like 100 years ago. Very interesting. And essentially what that means is parents, would kiss their child, and if they were sweating a little bit, it would be very, very salty, and so that could be an indicator of this disease as well. So obviously we have progressed past just kissing on the forehead, but I thought that was an interesting tidbit there. All right. So let's move on to some genetic testing for CF. So this can be done at any age. That doesn't have to just be done in newborns or in older people, but the majority of people with CF are diagnosed at birth or by age 2 via genetic testing. It can also be done later in life if a child or an adult presents symptoms, or if an adult wants to know their carrier status. The DNA, so within the genetic testing, what happens is they're going to take a bit of the DNA, usually a blood sample, from the person who is requesting the testing, so either the child, the adult, whoever it is, and they're actually just going to analyze it for mutations of that CFTR gene on chromosome 7. There are a lot of companies that offer this screening or this genetic test. And some include LabCorp, Ambry Genetics, among others. It can be a little bit costly. It's about $3,000 from the research that I had read. And I stated this before, but just want to reiterate that usually a diagnosis of CF is a combination of a sweat test, a genetic test, and maybe even a newborn screening as a first line of defense. So there are a couple different things that go into the diagnosing of this specific disease. All right, so the outlook for CF. While there are no cures for cystic fibrosis, there are several treatment methods that are used. I mentioned this on the onset of our presentation, but the management of cystic fibrosis has improved significantly over the past 70 years. Treatment and management really just includes the treatment of airway infections, encouragement of good nutrition and active lifestyle. Because CF can kind of present in a number of different ways depending on the individual, it really requires a close level of relationship with a good specialist and maybe a multidisciplinary team that can help tailor the treatment to the individual with CF. Most individuals with CF are on one or more antibiotics at one time, even when they're healthy, just to prophylactically suppress infection. So there's usually an antibiotic regimen that most CF patients are following regardless of their symptoms at the time. Moving on to kind of what's next for CF among other genetic diseases, researchers are looking to gene therapy as maybe an answer. It's been explored for a potential cure. Right now, many of the clinical trials have not really shown good success, very limited success. There is one study in 2015 that shown a small benefit, so that's a good sign. Obviously, we're still in the works with a bunch of that, but I thought that was an interesting tidbit. Really, the focus of gene therapy for CF and in general is to aim to replace the mutated CFTR gene by injecting or inserting a healthy CFTR gene into those affected cells. Multiple approaches in these specific studies have been tested for that gene transfer, things like liposomes, viral vectors, in animal models and those clinical trials. So lots of different modes and methods have been tested. Obviously, no real success so far, but there could be great benefit if the researchers are able to inject that healthy CFTR gene into affected patients. So definitely excited about that. And then last but not least, the prognosis for CF. Cystic fibrosis has improved greatly due to that early diagnosis that we talked about through screening, newborn screening, prenatal screening, and just obviously improved access to healthcare over the year. In 1959, the median age of survival was only 6 months, and for a patient or a newborn born in 2016, so about 3 years old now, the average life expectancy was 47 years old. So obviously a huge improvement there, and that's just due to advancements in technology and treatment over the years. So that's all I have for you today. I have some references at the end here that are linked throughout the presentation. I hope you enjoyed the presentation, and